In this video, we're going to talk about lung volumes and ventilation. That way we can understand pulmonary system efficiency and function. Hey everyone, welcome back to the second video in our lecture series. Today, we're going to talk about pulmonary lung function and volumes. This content is going to form the basis upon which we'll discuss respiratory pathology. It may not be the most exciting content unless you love graphs and science terms, but it is important. I'll try to make it as simple and interesting as possible, so grab your latte and let's get started. So what actually is ventilation? Well, ventilation is just the exchange of airflow between the atmosphere and the alveoli. So if you think about that, what it really means is that we're just breathing. But since we're all smart and scientific, we call the process of breathing ventilation. So there are 4 different lung volumes that we need to talk about. There's tidal volume, there's inspiratory reserve volume, there is expiratory reserve volume, and then there is residual volume. Now these air volumes actually vary with age, sex, and height. And women have about 20 to 25% of the air volume that men do. So let's start talking about tidal volume. Well, tidal volume is just the volume of air that's exchanged during a normal inhalation and exhalation. And I'll put the graph up, that way you can see it. Tidal volume is about 500 mLs. You're exchanging about 500 mLs of air in a normal breath. In order to measure tidal volume, you might tell somebody just to breathe normally. Inspiratory reserve volume is the amount of air that we inhale in excess of tidal volume. In order to measure this in another person, you might tell that person, at the end of your normal breath in, inhale as much air as you possibly can. Inspiratory reserve volume is about 3,000 milliliters in a 70 kilogram male. The third volume we talk about is expiratory reserve volume. Expiratory reserve volume is the amount of air you can forcefully exhale at the end of a normal exhalation. In order to measure this volume, you might tell somebody, at the end of a normal exhalation, try to breathe out as much air as you possibly can. Expiratory reserve volume is about 1,100 milliliters of air. Now, when we talk about these 2 volumes, inspiratory reserve volume and expiratory reserve volume, the key word here is reserve. So if you're reserving something, you would normally hold it back, right? When you have a reserve volume, you're not normally using that volume. You're normally holding it back or keeping it in your lungs. So that's kind of key when you think about inspiratory reserve volume and expiratory reserve volume. These are the 2 volumes that you normally would not use. If you want to use them, you have to force yourself or think about taking a deep breath in or a deep breath out. Now let's talk about residual volume. So residual volume is the amount of air that remains in the lungs at the end of a maximal exhalation. Residual volume measures about 1,200 milliliters. Think about residual volume as the air that can never be breathed out, no matter how hard you try. Residual volume cannot be measured directly, and it exists because the lungs are stretched against the thoracic wall. Residual volume can actually increase with certain diseases. So for example, a disease that would increase residual volume is emphysema. So in emphysema, the patient is air trapping just because of the nature of the disease. Their lungs get hyperinflated, they're holding more air in their lungs, and they actually just can't breathe out as much air. If you remember from the previous lecture, we talked about the decrease in elastance that the lungs have in emphysema. So the lungs are hyperinflated and you cannot breathe out all the air. You are air trapping or holding air in. And the fact that you're holding air in your lungs that you cannot breathe out means that you are increasing the residual volume. Because remember, the residual volume is the air that cannot be breathed out of your lungs. Now let's move on to talking about capacities. So what is the difference between a volume and a capacity? Well, a capacity is actually just the sum of 2 or more lung volumes. And the first capacity that we need to talk about is called vital capacity. Vital capacity is tidal volume plus your inspiratory reserve volume plus your expiratory reserve volume. So think about vital capacity as the total amount of air that you can use. If you want a prettier definition, vital capacity is the maximum amount of air that can be moved into or out of the respiratory system in one breath. To measure vital capacity, you might tell somebody, take in as much air as possible, now blow it out. So let's stop and think. Let's breathe. Take in as much air as possible, now blow it out. That is your vital capacity. Now let's talk about total lung capacity. So total lung capacity is your vital capacity plus your residual volume. So that means that's your tidal volume, your inspiratory reserve volume, your expiratory reserve volume, and your residual volume. Total lung capacity is the total amount of air that the lungs can hold, and this approximates 5,800 milliliters. Those are the two main capacities that you'll hear spoken about, but there's two others that we should discuss. Your inspiratory capacity is your tidal volume plus your inspiratory reserve volume. Your inspiratory capacity is the total amount of air that you can inhale from a normal point of exhalation. So if I'm just breathing along, normal breathing, very steady breathing, and then at the end of a normal breath out, I take a huge breath in, that is my inspiratory capacity. Now your functional residual capacity is the amount of air remaining in the lungs after a normal exhalation. This is your expiratory reserve volume and your residual volume. I like to think of this capacity as the amount of air that might as well be your residual volume. It might as well be the air that you never exhale because you're not forcing yourself to exhale it. Now maybe you're really curious, or maybe you have a physiology teacher that likes to push you, or maybe you're nerdy like me. You might be thinking, well, how would different diseases affect lung volumes and capacities? Well, we're going to talk about that right now. So let's start with obstructive diseases. So in obstructive diseases, something is obstructing the airflow. That's why they're called obstructive diseases, right? So you can't get as much air out and you can't get it out as quickly. So air is going to stay in your lungs even after a full exhalation. So examples of obstructive diseases would be something like asthma or maybe COPD. So let's take asthma, for example. So in asthma, the airway is very inflamed. And when you exhale air, if you exhale air out too fast, the bronchioles actually collapse and then you trap air in your lungs. So in asthma and in other obstructive diseases, you decrease your expiratory reserve volume and therefore you decrease your vital capacity. This increases your residual volume. However, your inspiratory reserve volume will be fine, and so will maybe your tidal volume. Those will be unaffected. But what is affected is your expiratory reserve volume and therefore your vital capacity. But in restrictive lung diseases, something is restricting the lung from expanding. The lung can't get enough air in. So in the last video, we talked about fibrotic lung disease as an example of a restrictive lung disease. So in fibrotic lung disease, you can't inhale as much air, which means your tidal volume will decrease and your inspiratory reserve volume will decrease. And if you can't get a deep breath in, then you don't have as much air to begin with, which means you can't blow as much air out. So that also decreases your expiratory reserve volume. And all of these together make up your vital capacity. So your vital capacity will also decrease. Well, you did it. Congrats. That was definitely a lot of definitions, but I know you did great. When I was learning this content, I probably looked like a weirdo because I would go around practicing my breathing. I take a deep breath in and call that my inspiratory capacity, and then I take a huge breath out and call that my vital capacity. But hey, whatever it takes to help you solidify the content, right? If you're studying physiology and finding that it's difficult, I'll put a link to some helpful books in the description below, so check it out. And if you're getting ready to take an exam, feel free to watch this content as many times as needed. If you found it helpful, give this video a big thumbs up. And don't forget to subscribe so you never miss another one of my videos. I hope to see you guys next week. Until then, stay calm and breathe on.